All right, Matt Wiederholz with Performance Pain and Sports Medicine again here. So we're in the post-op area with Stephanie. We've just placed a trial neuromodulation system or spinal cord stimulation system. We are now in the process of turning the device on, programming the device so that Stephanie can now test out this technology for the next week and make a decision whether this is the right type of pain relieving technology for her. So I wanted to take just a moment, Stephanie, if you could just talk about the type of pain that you're dealing with and what we discussed before we move on.
For me, pain-wise, mostly the phantom pain and lower back pain. It's usually when I'm standing, walking a lot, sitting, laying down. I just can't really find a comfortable position or do any of the activities. Just daily little things. I can only do like 15-20 minutes at a time, so kind of hoping this will work over, I don't know, try it before some of the surgeries I've seen my friends do 2 or 3 in just a couple of years on their back, and I've also seen friends try to recover from it. It's not fun, it's kind of scary, so I hope this is not so scary for me to try.
Certainly. So the biggest thing that biggest reason that you decided to move forward with spinal cord stimulation was to avoid further surgery. Is that correct?
Right, and that was part of the reason for the amputation too, was to avoid more surgeries. I read great things about this several years ago, so I have been going from doctor to doctor trying to find someone that would let me give this a go.
Absolutely.
Yeah, definitely, especially when I'm laying down, some of the phantom pain is just undescribable pain, and it makes it really hard to sleep. So like when my back is not hurting that night, then I'm dealing with the phantom pain. So,
sure.
So it's no rest.
So Stephanie actually has several indications for neuromodulation. She has had a lower extremity amputation and suffers from phantom limb pain. Phantom limb pain is the type of neuropathic pain or nerve pain that amputees will experience after the limb is amputated. Because the nerves are cut, usually those nerves will still send signals to the brain or to the spinal cord, which are interpreted in the brain. Some of those signals can be painful signals, like in Stephanie's case, and what neuromodulation does is essentially block those pain-transmitting signals that are going to the spinal cord. Stephanie also deals with some back issues. And so folks who've had prior back surgery and have nerve pain in the back and legs are also candidates. And so Stephanie actually has at least 2 indications for neuromodulation. So we're hopeful that she's going to have a successful trial. We're going to allow her to use this for the next week, and then we will update everyone at the time that we pull the leads out. And hopefully we'll be discussing the successes that she's had over the next week, and we'll talk a little bit more about the actual technology at that time as well. Anything else you wanted to comment, Stephanie?
I'm just hoping, because one of the major things is the longer that I walk on this, the more phantom pains I have at night. So if this will help me be able to walk longer and not hurt so much at night, that's going to encourage me to want to walk more. So, that's what I'm really, really hoping for too. So, okay.
Awesome. Well, Dr. Wiederholz at Performance Pain and Sports Medicine with Stephanie doing a neuromodulation or spinal cord stimulation trial. Thanks for joining us.